welcome to the Stroke Recovery Group. I'm so glad you're here. Hello everyone, welcome back to the I Care for Your Brain Stroke Recovery Group, proudly sponsored by the Foundation at First Health. I'm so glad that you decided to join us again. We are more than halfway through our sessions of education and empowerment. What we're going to do before we start Rule 6 today is just go through our first 5 rules and give you kind of the bullet points to make sure you really soaked up all the knowledge that was there. In rule number 1, we talked about making your map. And what I meant by that is identifying all of your post-stroke symptoms and seeking an expert evaluation to tell you exactly where you are right now in your recovery and help pinpoint exactly where it is you need to go in the future. The expert's job is to give you realistic, small steps to get you to your goal. In rule number 2, we talked about the importance of building on what's familiar to you. And what we meant in this rule is how important it is to personalize your recovery efforts. Your rehabilitation therapies should be as uniquely tailored to you as they can possibly be. No 2 brains are the same going into a stroke, no 2 strokes are the same, and no 2 stroke recoveries are the same. So we don't want to give you just cookie cutter rehab. We want to make it really personalized to you. Rule number 3 is the power of repetition and consistency. Repetition is the fuel that drives neuroplasticity, and consistent means that you're on a schedule doing it on a regular basis. No dropping off, no ramping it up. We want you to just do it on a regular day-to-day basis. The repetitions that you're going to need to do to get to the best outcome with this stroke are pretty darn high, and a lot higher than they're going to offer you in outpatient therapy sessions. And so it's important for me that you know that so you can implement a structured strategy on your own outside of those sessions. Rule number 4, we focused on harnessing your creative power. And what we talked about there is the importance of breathing some life into this stroke recovery. We want you to enjoy creative arts. We want you to appreciate things like music and writing and dancing and just trying to bring more spontaneity and joy and a sense of wonder and awe into this recovery. In rule number 5, which was last time, we talked about the importance of prioritizing sleep. And what I want to do before we start rule number 6, which is where we're at today, is let's just go through a brief recap of rule number 5 to make sure you got all of the pearls. In session number 5, I hope that you learned that you must balance the hard work of recovery with long periods of high quality, uninterrupted sleep. We talked about the power of good sleep in terms of quantity and quality to enhance your ability to recover because it promotes chemical, physical, and emotional healing. Sleep has very important restorative jobs that are unique to the brain and the brain's healing. Statistically, more than 70% of you who have survived a stroke have a sleep disorder. I wanted you to consider things that might be getting in the way of sleep, like medications, medical conditions, poor sleep hygiene. We talked about different strategies for getting a good night's sleep that were behavioral changes that you can make. And if none of those worked, I encouraged you to advocate for a sleep study. The bottom line of rule number 5 was that sleep is a staple of physical, mental, and brain health, and I want you to pursue it vigorously. Untreated sleep problems will reduce your ability to recover from your stroke. Brain repair mechanisms are activated during deep sleep that break down the damaged areas that need to go so we can plant the good soils of new seeds for your recovery. Now we're going to move on to rule number 6. This one is all about emotional resilience, the importance of making sure you're not struggling with any additional symptoms in your mood or your behavior that will interfere with your recovery. I'm going to encourage you that a positive and motivated attitude is going to get you a better outcome. Stroke recovery is an emotional journey that's different for everyone, but typically happens in the following stages. Initially, it's very normal for most people to feel a sense of shock and emotional numbness. As I've said before, many people view a stroke as a trauma that was unexpected, was life-threatening, and that most people respond to with a sense of helplessness or shock. So it's very important to not know what's really happening for the first few hours or even first few days. Oftentimes people can go into a very normal state of denial. It's hard to wrap our head around the fact that in a very short amount of time, things have significantly changed for us. Oftentimes people then can get angry. It's a very normal sense of resentment. Why me? This wasn't what I expected. This isn't how I wanted my life to go. Oftentimes as human beings, we then transition into a state of bargaining, almost an irrational conversation with the world about, if you get me through this, I'll do this, kind of a trade for a good outcome. The next one is depression, and that's really what we're going to focus on today, post-stroke depression. This is a feeling of hopelessness, feeling that this is a much heavier burden than we can bear. Oftentimes people then slowly can come into acceptance, specifically if there are care partners in your journey that support the process of grieving for what was, acknowledging what has changed, and helping you find a way to recreate a life of meaning and value. Oftentimes that's the turning point, is when we can try to find some meaning in our trauma that helps us understand the big picture and how our life will be shaped, not just negatively by the event, but maybe also positively. And finally, in the circle of coping, we come to helping others. Oftentimes we have to go through our own healing journey before we can find the energy and the focus and the motivation to try to help others. And the idea here is to make someone else's stroke journey a little bit less difficult, a little bit less arduous and painful than yours was, based on the knowledge that you now have coming out on the other side. Emotional health matters a lot in this recovery. I really want you to take this serious. Stroke recovery is not just about healing your brain. It's also about healing yourself. The ability to have emotional strength after a stroke has a major influence on your recovery. Identifying and treating very common mood symptoms like post-stroke depression must be a priority. And in fact, post-stroke depression is the main factor limiting recovery after a stroke and leads to greater disability and reduced quality of life. So it's really important that we talk about this. Post-stroke depression is more than just feeling sad every now and then. To get a diagnosis of depression, this requires that for about a period of more than 2 weeks, we feel depressed, we feel like we don't care, and we have at least 4 of the following symptoms. Changes in appetite and weight. This can be less appetite for some, more appetite for others. Some people may want to sleep all day, other people are too agitated to sleep. There can be agitation, a feeling of not being able to be at peace in your own body, difficulty sitting through, racing thoughts, feeling like you just have to get out of here. The next one is hyperactivity, very similar to agitation, but doesn't quite have the angsty anxiety undertone, just a feeling of wandering, not being able to really settle down, always a feeling that there's something you should be doing, but you're really not quite sure what that is. The next one that's very common is feelings of worthlessness or excessive guilt. And in stroke recovery, we often see this in people feeling that they would be a burden to someone else. People feeling very empathic towards their caregiver, feeling that they don't want their spouse to have to go through all of the things they're going through to take care of them. We also see difficulty concentrating, making decisions, just feeling like you're not going to know exactly what the right thing is to do. Thoughts of dying, feeling like you or your loved ones would be better off if you weren't here. And these symptoms have to be severe enough to interfere with some major aspect of your life. This can be that you don't want to be around people, you don't want to be social, you feel like you are losing important connections with loved ones, you're having a hard time managing anything independent in your life that you did before. Like I said before, symptoms of depression are very individual. There's no one way to be depressed. Sometimes people feel like you have to be suicidal to be depressed, and that's just not true. You can't always tell by looking at someone if they're depressed. People can hide it pretty well. Sometimes even we don't recognize that we're depressed ourselves. But when you cut across all different people and all different types of depression, what we typically find is that most people who are depressed talk about a sense of numbness, feeling overwhelmed, emotionally drained, and hopeless about their future. So I want to tell you a little bit more about post-stroke depression and specifically bring in some of the research. Between 18 to 55% of you after a stroke would be diagnosed with post-stroke depression if you were properly evaluated. But only 5% are actually diagnosed and treated. We have a long ways to go with this symptom. It's typically highest in the first year following a stroke. This is before people have had a chance to receive all the benefits of rehab, learn any adaptive strategies, and oftentimes it's just a matter of letting the days pass to learn how you're going to cope and adjust to this new life. Post-stroke depression is highest in survivors who do not have social support, who don't have a tribe helping them through their recovery, who have higher disability, whether it's physical, sensory, or cognitive, and have lower independence due to stroke-related deficits. It's been hypothesized that the way social support helps in post-stroke depression is that a close group of people around us help us by giving us emotional support, rooting us on, motivating us to do the rehab therapies, and supporting us with daily function, helping us get through our day so we're not facing such an uphill battle alone. Diagnosing post-stroke depression is difficult because many of the symptoms of depression overlap with the direct effects of stroke. Things like loss of appetite are difficult to interpret because many times people are left with difficulty swallowing after a stroke. We can also see that many people struggle with fatigue and concentration issues as a result of the stroke, nothing to do with depression. And things like sleep disturbance are very common after a stroke. If you were with me in the last session, we talked about the reality that up to 70 to 75% of you have a sleep disorder right now after a stroke. So the way that I recommend to my patients and my families that they try to tease this apart is that we have to pay close attention to the non-physical symptoms. And what I mean by this is asking the person, to the degree that they can respond, how are they feeling emotionally? And when we get responses that involve things like guilt, depressed mood, just feeling kind of sad, hopeless, feeling worthless, thoughts of dying, these are much more suggestive of post-stroke depression. But really, you need a neuropsychologist to help tease those things apart. It's important that we differentiate post-stroke depression from something called post-stroke apathy, and these are kind of close cousins that can run together. Many stroke survivors look as if they are depressed, but again, they're actually not, and it's really important that we ask direct questions to get at this answer. Apathy is a behavior syndrome that's common in stroke. Up to about 40% of survivors meet criteria for this disorder. And it's characterized by low motivation and what we call flat affect or flat emotions. And what I mean by this is that the person's never really necessarily down, but they're also not necessarily having any upward variation in their mood. It's kind of always a sense like this. This often happens when people have frontal lobe damage after a stroke, and even more so when they have bilateral brain damage. And what I mean by this is that both sides of the brain have been damaged by the stroke. The most instances we see of post-stroke apathy is when the same part of the brain is damaged on both sides. People with post-stroke apathy generally don't report the common depressive symptoms that we've talked about before. Post-stroke depression and post-stroke apathy are different in terms of the brain changes that cause it and respond to different treatments. Post-stroke apathy typically does not respond to antidepressants, and what gets these people better is non-pharmacological interventions, things like more stroke rehab, and also a different type of a medication called a stimulant that we talked about a few sessions ago when we touched on neurofatigue. So one question that I hope you're asking yourself is, am I maybe depressed? Maybe is my loved one going through depression? So I wanted to show you this assessment. This is called the Patient Health Questionnaire number 9, the PHQ-9. And this is the most common post-stroke depression screen. And maybe you've even gotten this when you've gone back in for a follow-up with your rehab team or your neurologist. And the question that we have here is, thinking back on your last 2 weeks, I want you to read all 9 of these questions, and I want you to make a decision whether or not you fall within the not at all, which is a 0, several days of the last 2 weeks, which would be a 1, more than half of your days, which is a 2, or nearly every day of the last 2 weeks would be a 3. And what I'd like you to do is take some time right now with me, and maybe even more time once we're done, and go through each of these questions. So if we briefly go through them together, number 1 is little interest or pleasure in doing things. And again, I want you to kind of compare this to pre-stroke, post-stroke, with an emphasis on the last 2 weeks. Number 2 is feeling down, depressed, or hopeless. Number 3, trouble falling or staying asleep or sleeping too much. Number 4 is a feeling of being tired, having very little energy. 5 is poor appetite or overeating. Number 6 is feeling bad about yourself, that you're a failure, you've let yourself down, you've let your family down. Number 7 is trouble concentrating on things like reading the newspaper or watching television. Number 8 is moving or speaking so slowly that other people have noticed, or the opposite, being so fidgety or restless that you have been moving around a lot more than is usual. And the last one, number 9, are thoughts that you would be better off dead or hurting yourself in some way. Now, you might have noticed that a lot of these symptoms can overlap with stroke deficits, and that's why it's really important to go through this with a professional where you can give a nuanced answer. It's not as easy as yes, no, or really even going from 0 to 3. You may have trouble speaking, and it has nothing to do with the slowness that comes along with depression. The cutoff that's recommended to us after a stroke is number 6. So once you add up all of your numbers, if you got a score that was greater than 6, I want you to be concerned about the possibility you or a loved one could have post-stroke depression. And here's why it's important. If you don't treat it, look at all of these different effects it's going to have on you. You're going to have more pronounced cognitive symptoms, you're going to have more long-term disability, you're going to have a lower quality of life, and you're at greater risk for dying as compared to those who've had a stroke who are not depressed. So we have to really focus on what are we going to do about it, okay? So let's talk about the treatment of post-stroke depression. The best results happen when we bring a combination of interventions to the person, and this typically involves pharmacological measures, this is medicine, psychosocial interventions, which means we help someone reintegrate into the world with confidence, we help their families, not just them, and stroke-focused treatment, such as a lot of physical rehab, a lot of cognitive rehab, a lot of speech therapy. And what we've also seen in the scientific literature that really helps people with depression is education on how to prevent another stroke. And what that must be related to is that the fear, the dread of having another stroke weighs very heavily on people. What we're going to focus on in this session today is the importance of increasing your emotional strength or resilience. What are the things that you can do to make your thoughts and your actions as positive as they can be? So what is emotional resilience? Well, it has a really nice definition. I think this is very, very helpful. Emotional resilience is a way of coping after a major stressor that allows some people not to have their spirit broken and continue living a life of quality despite new challenges and limitations. Rather than letting a stressor or a trauma overcome you, believing that you will find a way to rise and go on to live a fulfilling life of meaning. There are 11 ingredients to resilience when we look into the scientific literature, and I want you to go through these with me right now and think of where you maybe have already had some success, but where you may need to focus your efforts going forward. The first ingredient is feeling safe and secure. For stroke survivors, this is especially important in your own body. That is a very difficult part of living after a stroke, is not knowing how to interpret common aches and pains, headaches, anything that reminds you of what you lived through right before the stroke is very normal to become a trigger for people's anxiety or depression. Number 2 is just a basic life view of the glass being half full, feeling that there's a sense of hope within you that things can improve through hard work and adjustment. The next one is experiencing regular positive emotions. We're going to talk about this a lot more in a little while, but what we know is that these are joy, gratitude, serenity, and love. Those should really be the focus of every one of our days, stroke or no stroke. That is the focus of living a well-balanced emotional life. Number 4 is one that's very important to me, which is compassion for yourself. It's very important to love on yourself in the same way that you would a best friend or a sister. You need all the compassion that you can get in this stroke recovery. Having a sense of humor is very important. Laughing is an incredible stress reliever, can kind of break the intensity of rehab when it gets really tough. Very important to make sure that you're laughing as much as you can. Validating relationships. What this means is that you are surrounded by even just one person who really gets it as best they can. Like I've told you before, those of us who haven't had a stroke, we really can't presume what it's like to walk in your shoes. But there are some of us who are better at noticing your struggles, who validate how hard it must be, and really can act as your cheerleader in a realistic way to keep you going. Research tells us even if we just have one person who plays that role for us, we're really going to be okay. The next one is finding meaning in our life and living our values. This is really the essence of what it means to live a good life, is that we've identified what's most important to us, and every day we take actions to realize those values and goals. The next one is reaching out for help when you need it. I know that this is very hard for some of you. Maybe you're not used to asking for any help prior to your stroke, but the truth is it really does take a village, and you're going to have to learn to be comfortable for asking for what you need. And I really love these last two, accepting support and accepting yourself. Maybe these are the two ultimate goals, really, and we have to go through all of the other ingredients of resilience to get to these two. But here's the great news. These traits can be learned and developed at any time, including after a significant stroke. What I want you to know is just like developing any new skill, increasing your emotional resilience takes time and intention. And that's what I think is really important about this rule, number 6, is that we're not just saying you should have a positive attitude in this stroke recovery. We're actually going to go step by step and teach you how to develop that helpful mindset. So what we're going to do right now is go through 7 ways that you can increase your emotional resilience for a better recovery starting today. Let's briefly go through them and then we'll get into a lot more detail. Number 1 is developing emotional awareness. This is where we know what we're feeling, we can identify what we're feeling, and we can communicate what we're feeling. Number 2 is viewing your recovery as a challenge that you can manage. How you think about this stroke and your ability to recover really matters. Number 3 is choosing to respond to stressors with action. We have to figure out what's within our control and what is not within our control. Number 4 is choosing positive coping over negative coping. We're all coping every day, all the time, and we can choose to respond in an adaptive way or more of a way that's actually going to shoot us in the foot. Number 5 is keeping a gratitude journal. We're going to provide you with one of those in the handouts from this session, but it's really important that we take time every day to take stock of what is going well and all of our many blessings. Number 6 is seeking support through therapy or medicine. And number 7 is that final part of recovery, which is giving back to others who are walking in your same shoes. So talking about emotional awareness, we like to use a tool that you can see here called the feelings wheel. People love the feelings wheel. This is where you can actually look on this wheel and try to identify what is the exact emotion that I'm feeling right now. Emotions are a combination of our thoughts, they're a combination of how we feel within our body, and they're a combination of our mood, which is kind of a difficult thing to sometimes put our fingers on, especially if we weren't raised in a very emotionally astute environment. So the feelings wheel has helped many people that I've worked with get really clear on exactly what it is that they're feeling. And as people use the feelings wheel, what I really find is that they grow to value and respect their emotions. This can really help people who are sometimes overwhelmed or unsure of exactly what it is they're feeling. In my experience, when people can't quite pinpoint their emotions, they tend to feel very overwhelmed, or they push it deep down and go into denial. And when you're not sharing how you're feeling with your inner circle, it's really easy to feel very alone. The more you feel your emotions, the more you can make yourself feel more positive emotions. So remember before that I was talking about the importance of prioritizing joy, gratitude, serenity, and love. Well, what you can do is look on this feeling wheel and look at all the emotions around it and see if you're feeling any of those. And every day commit yourself to try and have more and more of those emotional experiences. Once you know how you feel, then you can share them with other people. And again, this is one of those bridges of connection that is so important in your recovery. Remember before I said how you think about this stroke and your stroke recovery matters a lot? What the research tells us is that viewing any major stressor as a challenge that you can handle is the most helpful way to think about it. Very often the way we label our experiences in life are actually not very conscious. They're not very much in our close awareness. So oftentimes you really have to take some quiet time and think about, how is it that I'm judging this situation? How have I labeled it? And what that label is, we call that your cognitive schema. And that matters in any major stressor that happens in life. It's very important to know that ultimately you will handle this and that you have the resources within yourself or people around you who love you can bring you the resources to make this a challenge that you can manage. So one way to actually bring that to life is self-talk, positive self-talk. So these are some recommendations that can maybe replace some of the more negative or pessimistic thoughts you could have as you go through this stroke journey. I'm scared, but I can handle what's happening and I will learn from this. This is going to make me stronger. I have people around me who are going to be here no matter what. I've made it this far and I'm going to keep going. My recovery is tough, but I am tougher. And I actually took this next one from a t-shirt that I saw that said, "Nice try, stroke, but I'm still here." Again, that's maybe where a little sense of humor comes in. Respond to stressors that are within your control with action. This is a great piece of life advice, but very important as we are in a recovery journey. So the question then is begged, what is within our control? Many of us take on way more responsibility than we really should, than is really good for us. So I want you to look at this list here of things that are within your control and things that are not. And I hope that the first thing you notice is that there's a lot more things within your control than are not. So you have complete control today over your mindset, the way that you decide, you judge, and evaluate situations. Your work ethic, how much you are going to put into this recovery. The way that you treat other people. The things that you eat to some degree. I know some of you are on feeding tubes and that makes that piece of control a little bit more difficult. Same thing with breathing. For many of you, you have control about the ability to take nice, deep cleansing breaths, but not all of you. Self-talk, the things that we say to ourselves in our own mind, we want to make sure that that is a supporting, loving place, not a critical, demanding, unsupportive place. How much love you give to all the beings in your life, animals, helpers, other people. How kind you are to people, including yourself. And how you conduct yourself today, right here, right now. Things that are outside of your control are the past, really the future, other people's feelings, other people's happiness, forcing other people around you to understand exactly what it is you're living with. You really can't control that beyond being a good communicator. So once you really have made your columns and you figured out, okay, this I think is within my control and this is not, you really have two choices. There's two different types of control. The first one is what we call primary control. And the question that goes along with that one is, what can I do that would make a difference? This is your ability to actually change a situation. So when you've decided something is within your control, you can take reasonable action to change that difficult situation to the extent that you realistically can. Remember, you want to stay within your bubble of self-responsibility. When it's something that you cannot control, like another person's happiness or how they view your stroke, then we have secondary control. The question here is, how can I think about this differently? This is how you change how you're thinking about a situation. When you're unable to control the situation, secondary control helps you find the most positive way to view a situation. And I think it's really important that we acknowledge and you keep in mind that how you respond to this stroke is at least in part under your control, and that you can choose to some extent how difficult or painful this journey is going to be. So really, in any given moment in this stroke recovery, you have a variety of doors in front of you. And some days it's easier to choose the lighter, more sunlit door. And other days it feels almost impossible not to pick the darkened doorway. But remember that every day you can choose to pick a different door. I want to talk about coping, because like I said before, we're all coping all the time, every day, or else we wouldn't be here. There are two big different types of coping. We have positive coping, which we think of as more adaptive, helpful coping. And we also have negative coping, which we can call maladaptive, unhelpful coping. And the challenge is that sometimes we can trick ourselves into thinking that the negative coping is actually better, because negative coping oftentimes allows us in the moment to avoid what we're actually feeling and not take any action steps. So in this graph here that you can see, what we're going to do is go through two different scenarios for each type of coping, and I'm going to suggest that you try to consider incorporating more of the positive coping than the negative. So the first one here is when we're positive coping, we can give names to our feelings. Get really specific about what we're feeling. Use that feelings wheel. When we're negatively coping, we don't acknowledge that we are upset. People can read it all over our face, but when they ask us if we're bothered, it's very easy to say, oh, I'm fine, don't worry about me. Very important that we specifically name what's going on with us and communicate it in an assertive way. And being assertive really is finding that sweet spot between owning some respect, taking some for yourself, but also giving the other person respect. When we are pushing our feelings down over time and at such an intense level that it pops up as aggressive communication. And that's very, very common. If we deny an emotional reality for a very long time, what we do is we snap when something little happens. And so we really want to try to hold respect for ourselves when we communicate with other people, but also respect that we don't want to mistreat them by being irritable and overreacting. So very important not to stuff our feelings. Making positive coaching statements to ourselves is a form of positive coping. One thing that you can start to realize when you really tune into your thoughts is that we are chattering away to ourselves all day long, and we are in control of that self-talk. So what we want to do is make good choices about the types of things that run through our head all day long. Many of us, once we start to tune into our self-talk, are pretty surprised and even kind of disturbed by how much negativity can run through our minds every day. So as you go through your rehab therapies, I really want you to be mindful of being supportive to yourself. The next one is focusing on what you can do differently next time. This is a form of positive coping. So negative coping would be denying any responsibility for what we bring to the table, right? And in a way that feels a little bit better in the moment because we don't have to feel guilty, we don't have to make a change in our behavior. But it's really important that we always try to bring our best self to any interaction, and when we can't, to just be realistic with ourselves about what we could do better next time. Under positive coping, we have seeking support from a trusted friend, okay? This is if we experience a stressful thing, we're not feeling really good, reaching out to somebody that we know will help us work through our feelings. On negative coping, instead, we might go have a few drinks. And what's the end result there is we numb out how we feel and we keep it all to ourselves. Positive coping has us doing something physical, changing our physical environment to the extent that we can when we're stressed out, okay? Negative coping is staying there, eating high sugar things, high carb things, trying to change the way we feel through food. Under positive coping, we have spending time with people who make you feel good, and under negative coping, isolating yourself. And again, remember that trick that your mind is trying to play on you. Sometimes in the moment, we feel like we should just be all by ourselves, but really ultimately that's going to worsen our mood, lead to a greater sense of loneliness and isolation. Going back to positive coping, we have finding the silver lining of wisdom or humor in what we're going through. And under negative coping, we have making blanket negative statements. Things are never going to work out for me. I'm never going to be the same. I'm never going to be like I was before. Once we hear people making very negative blanket statements, things like never, always, from now on, that's really a clue to us that they are coping pretty poorly. Under positive coping is taking those 10 big belly breaths to get a brief distraction. When we're negatively coping, we have that broken record going on over and over and over in our heads, and we're just thinking about the stressor repeatedly. And the final one is giving in to some kind of a higher power through prayer or meditation. finding your center so you can get back to a problem-solving mindset. When we're overwhelmed and we're isolated and we're not even sure of what we're feeling, we really can't take positive action. When we're negatively coping, we can feel so overwhelmed by anger that we can't make a plan to move on and we stay stuck. So this gets back to that idea of when we take reasonable action that is within our sphere of control, we are positively coping. And not only do we feel better, but what we know from the scientific literature is that your recovery is going to be better. The next recommendation is to keep a gratitude journal, and this is another thing we're going to include in your materials for this series. Writing down 3 things every day that you're grateful for has scientific support for increasing emotional resilience. And with all things in life, my motto is, if Oprah does it, then it's good enough for me. One thing I'd like you to consider is psychotherapy or counseling. This is a very underutilized intervention in my experience. About 2 years ago, 2018, there was a meta-analysis, which is what we do when we collapse a variety of different high-quality research studies to get more power to really see the effect of an intervention. So we looked at 23 different studies for post-stroke depression, and what we found was that cognitive behavioral therapy, or CBT, alone and in combination with medications like an antidepressant improved symptoms. When someone is doing CBT, there are different goals, and what they're really focusing on is how you think about your situation, the power of self-talk, the power of how we label our own emotions, the action steps that we take to improve our mood. So they can really help us develop more healthy, positive coping mechanisms, guide us towards activities that are actually going to make us feel better and not give in to those things in the moment that might be soothing but ultimately aren't really in service to us. Teach us how to manage some of the big emotions and adjustments that can come along after a stroke, and strategies for balanced thinking. One of the greatest barriers we all have as human beings is giving into what we call cognitive distortions. And that's just thinking of things in very black or white ways, thinking that we are mind readers, that we know what is in someone else's mind or their intentions. The truth is that it's very difficult to think about things in a very objective, balanced way, and CBT is really good at helping us understand that. If none of these behavioral strategies work, I want you to consider an antidepressant. There's been a lot of research in the last 10 years about a class of medications for mood called SSRIs, selective serotonin reuptake inhibitors. There's been specific research on Prozac, nortriptyline, and Lexapro showing that the way that these medications work is through the growth of new neurons, new brain cells in the brain. And when they've done research studies looking at folks in rehab after a stroke who have difficulty using a limb, who are depressed and who aren't depressed, what we see is that these medications, Prozac has the most support, actually help both situations. They help with depression, but shockingly, they also helped people get use of a limb back. So some of us are wondering about the early use of antidepressant treatment early on in rehab, and that this might be something that becomes the wave of the future, regardless if someone has depression or not. Once you go through all your own healing journey, what a lot of people find to be kind of the final step, and you might not be there now, that's fine, but just a way to look into your future, is finding a way when you're ready to give back to other folks who can really benefit from your experience and your journey. This can take many forms based on whatever you're interested in, whatever has been most heartfelt for you in this journey. Many people find a lot of value and meaning in visiting places like stroke centers and rehabs. I know a lot of times they have programs called a stroke buddy, where you can get teamed up with someone that has had a very similar stroke to you. You can talk about stroke prevention at a senior center. You can advocate for more progressive care with state government, with your local hospital, with your local rehab. Tell them in that assertive, respectful way what you didn't have that you now know you should have. What are the things that really would have helped you? What helped you a lot more than they might have anticipated? What was your personal experience, and how can we move the needle on stroke care forward? Inviting others to contact you. There's many, many people who have had strokes, and oftentimes we know a friend of a friend of a friend who knows someone. Making yourself available for phone calls or emails just to give them words of encouragement, help them understand what you learned in your journey. Having the idea, making a plan, and putting it into action on how you can help other people is very, very therapeutic. As you go through this emotional journey after a stroke, I really want to invite you to not judge yourself if you get overly emotional sometimes. We actually know that tears contain stress hormones, and different types of crying actually contain different types of stress hormones. If you look at different types of emotional tears under a microscope, it's fascinating because you can see they actually have different shapes and sizes. Grief tears look one way, angry, frustrated tears look another way, happy tears look another way. It's really pretty interesting. Crying activates what we call the parasympathetic nervous system. We also call that the PNS. The PNS helps our body rest and recover after a stressor. And there's some evidence that shows that crying for a long time, really getting it out, not just having a tear and kind of stuffing it back under, releases endorphins like oxytocin. This is one of those feel-good chemicals that can help us feel better physically or mentally. And this is probably why after we have a good cry, we're left with that feeling of calm and well-being. So after knowing all of this information, I really want to ask you this important question. Which one of these identities do you identify with now? Have you considered yourself to be a stroke victim? Are you a stroke survivor? Have you gotten to the point where you can actually consider yourself to be thriving? I want you to think about where you are right now and where it is you would like to move to in the future. And what I promise you is that your emotional recovery, prioritizing where you're at now with your mental health, making it a very valued part of your recovery, will help move you up the ladder to the next level of identity where you want to be. So the question is, which one of these are you going to choose? And remember, you have total control over this day and how you conduct yourself and the decisions that you make. So let's end with a self-empowerment statement. I will make my emotional recovery a priority. I commit to more positive coping starting today. Thank you guys so much for joining me. I really hope you come here for Rule 7. We're going to talk about the importance of supporting those who support you. Very, very important. Thanks again, and I look forward to seeing you next time. Bye-bye.